Can vitamin E treat tardive dyskinesia? Have you ever wondered if something as simple as a vitamin could help with complex movement disorders? Today, we are focusing on vitamin E and its potential role in treating tardive dyskinesia, especially for those dealing with schizophrenia symptoms. Tardive dyskinesia is a serious movement disorder that often arises from long-term use of neuroleptic medications, which are commonly prescribed for schizophrenia. This condition involves involuntary and repetitive movements, particularly affecting the face, tongue, and limbs. The exact cause of tardive dyskinesia is still not fully understood. However, researchers believe that oxidative stress and damage from free radicals in the brain may contribute to its development. This is where vitamin E comes into play. Vitamin E is a fat-soluble antioxidant that has been studied for its ability to combat oxidative damage. When it comes to research on vitamin E for tardive dyskinesia, the results are mixed. Some studies indicate that vitamin E may help prevent the worsening of symptoms but does not significantly improve existing symptoms. This suggests that it might play a protective role rather than being a cure. A long-term randomized clinical trial found no significant benefits of vitamin E compared to a placebo in reducing symptoms of tardive dyskinesia in patients currently on neuroleptic medications. The study measured abnormal involuntary movements and found no meaningful improvement with vitamin E supplementation. On the other hand, smaller studies and case reports have shown that higher doses of vitamin E, up to 1,600 milligrams per day, might lead to a significant reduction in the severity of tardive dyskinesia symptoms. However, these findings have not been consistently replicated in larger trials. Vitamin E is generally well tolerated, and patients often comply with its use. However, the optimal dose for treating tardive dyskinesia remains unclear. For individuals with schizophrenia, managing tardive dyskinesia is essential, as it can severely impact quality of life and complicate treatment with antipsychotic medications. While vitamin E may offer an antioxidant approach to reduce oxidative stress related to tardive dyskinesia, current evidence does not support it as a reliable treatment for reversing established symptoms. It may be more beneficial as a preventive supplement, especially for those at risk of developing tardive dyskinesia during long-term antipsychotic use. In practical terms, doctors often focus on adjusting antipsychotic medications, such as switching to atypical antipsychotics that carry a lower risk of tardive dyskinesia. They may also consider symptomatic treatments. Vitamin E could be an adjunctive option when other treatments are insufficient, but it should not replace established management strategies. In summary, while vitamin E shows some promise in preventing or mildly reducing tardive dyskinesia symptoms through its antioxidant properties, it is not conclusively effective as a primary treatment for tardive dyskinesia in patients with schizophrenia. Further research is needed to determine the best dosing and which patient populations might benefit the most.